Hello, my name is Mary DeLear. I'm with the Lupus Society of Illinois. The Lupus Society of Illinois was formed in 1973, and it's the Midwest's leading nonprofit health organization dedicated to working with lupus patients in Illinois. Our mission is to promote lupus awareness and complement the work of healthcare professionals by providing personalized resources for the lupus community while supporting research. This is the first of a series of programs we'll be working on with CAN TV. Our goal is to educate the community about lupus and the programs and services of the Lupus Society of Illinois. This event is for educational purposes only. This information should not substitute or replace expert medical care. Before making changes to your medical care, consult your qualified healthcare professionals familiar with your medical condition and health status. So just to start with a little bit about lupus. Lupus is a chronic autoimmune disease that can affect virtually any system in the body. Autoimmune means the body attacks itself. There are active and inactive periods of the disease called flares. 90% of people living with lupus are women, and African Americans are 2 to 3 times more likely to acquire the disease. There's no single test for lupus, and few treatments exist. Our first guest today is Dr. Meenakshi Jolly, who is the director of the Rush Lupus Clinic and a longtime supporter of our work at the Lupus Society of Illinois. Dr. Jolly, welcome.
Thank you so much.
I'm glad you're the first guest.
It's a pleasure to be here.
Okay, wonderful. What is the first thing you tell someone newly diagnosed with lupus?
Well, as you know, it's a chronic disease. My first advice is to know what you're fighting against. If you know what you're fighting against and you know the strengths and weaknesses of what you're fighting against, your enemy, then you can fight the war better.
Okay. What can someone newly diagnosed with lupus expect?
Well, it is a disease that is chronic, means it's not going anywhere. It's an incurable disease, but it has a lot of times when there are flares of the disease. So there can be disease time periods when it is in remission, it can be quiet, but at the same time there may be times when you may not see that the disease is active, but it may be active inside. So be prepared for frequent visits with doctors, medical care visits, lab tests, and medications.
So for someone who is in remission, they should still go and see you regularly?
Yes, they should they should still see the rheumatologist and their primary care doctor, because sometimes you may still feel you're in remission, but there may be disease that may be active within you. And a doctor's history exam and lab tests can help the doctor reach that decision. It is good to diagnose any flares early on, to catch them early, treat them early, and prevent damage.
Okay, so because oftentimes people with lupus don't look sick.
Yes, that is a common thing that we hear from patients. Another misconception that we see in patients, they will frequently tell us that their family members or friends say, "You look fine, how come you're sick? You can't do this, or you can't show up for this."
Mm-hmm. But inside they're
Yes.
incredibly sick. And the only way to know that really is to see a doctor who is skilled in treating lupus and
Yes.
knows what to look for.
Yes.
So how can people living with lupus manage their disease?
So what I would say again is be educated about the disease, learn more about it, learn about your medicines, be an active partner in your treatment. Discuss with your doctor what is going on, what do I need treatment for, what medications, what is it treating, what are the side effects. Be an equal partner in the treatment. Get to the decisions that are being made for your care with the doctor. Be engaged in your own care. And then maintain a healthy lifestyle. Follow up with your doctor, the recommendations. If you can reduce stress in your life, work towards that.
Because it is such a complicated disease. When they're talking with you, does it help for them to, when you say educated about your disease, understand the treatments that they're on, follow the treatments that they're on, ask questions? Is it appropriate for them to call and ask questions between appointments?
Yes, frequently we will get questions from patients, but it is good to plan before your visit. What are your questions? I suggest to my patients to keep a diary. Sometimes, randomly one comes up with some question, and then by the time you have a doctor visit, you've completely forgotten it, because we have other things on mind. We are getting results, new medication, so much discussion going on that some of the questions that we wanted to ask may slip out. Time is limited during the appointment, so it's good to write down what are your questions, prioritize the questions, and then ask the doctor when they are there. Definitely, if questions arise in between that you don't understand and seem important, you can reach out to your doctor. You can leave a message. You can do MyChart these days on electronic medical records that the doctors can get back to you. Definitely for an emergent sort of health questions, you need to use your judgment if you need to be seen in the emergency room for an emergent health situation rather than wait to hear back from the doctor.
Right, and that's actually a really good point. You never want to err on the side of caution there. If you feel like you need to go to the emergency room, you need to go to the emergency room. So you've done a lot of work with body image in lupus.
Yes.
Do you want to tell me a little bit about that?
So this disease affects the patients inside out, top to bottom, anything and everything that you can see. No two lupus patients' disease is the same. So starting from outside, people can get a lot of rashes, hair loss, loss of teeth, from the side effects of medications. Their appearance can change, acne, hair, facial hair, or striae from being on steroids, or even joint deformities or such. Those are some examples. So our visible appearance to others may change, but apart from that, our function, physical function, what we can do, our abilities to do things may change. Our functioning, emotional functioning might change. Side effects of medicines might change, as we may be tired, we may not be able to sleep very well. So all these things can make a person feel that they're not capable of doing a lot of things that a young person in which this disease usually happens is expected to be. Nobody expects a young person to be sick chronically and not be able to do simple things, right? So it can really affect what a person thinks about their body and how they estimate their body. So I feel that though the disease is not curable, there are things we can do to decrease the stress, the anxiety, depression, or give tools to the patients to deal or cope with these kinds of issues related to body image. Because at the end of the day, a young person, a young woman especially, or any patient with lupus has to do the tasks that are age appropriate, whether that is education, dating, marriage, work, taking care of other family members, and they should be able to do that and not go into social isolation because of depression or poor coping.
And one period of time that I've always found different in all my years of working at the Lupus Society is that change from, because you can be a child with lupus, and then transition to becoming an adult with lupus. And those years, maybe between 17 and 23, seem to be especially challenging.
Exactly. Tell me any young person who doesn't feel bothered by, say, an acne breaking out, or people my age, hair loss, or this or that. We people who don't even have lupus or chronic disease are frequently thinking about our body image because of a small acne or something like that. Now think about people who are actually sick with lupus. They are in the same age group. I have patients telling me that when they go for job interviews, it seems that the person who's interviewing them is seeing their lupus first before even making an eye contact. Now definitely there's an elephant in the room. So these are things that can affect body image of the patients. And if we can empower people by understanding more about the body image, addressing those concerns as they arise, deal with educating them, supporting them, empowering them, can give them confidence and make improvement in their quality of life.
Yes. Well, I think your work there is really exciting. And I think you touched on something that's really important, which is support.
Yes.
And our next guest is the leader of a support group that you've also been involved with. So we're going to bring her out. Before we go to LaShawn, I want to go ahead and just remind everyone about the disclaimer. And we're going to play a little bit of musical chairs here. All right, wonderful. Y'all ready? And welcome back. It's Mary DeLear with the Lupus Society of Illinois, and this is one of our most spectacular volunteers and a support group leader, LaShawn Garola.
Thank you.
So close. And LaShawn is a nurse at Rush, and she's also a support group leader, and she's a spectacular volunteer as well. We feel very lucky to have her with us today.
Thank you.
So, LaShawn, as a lupus patient, let's talk first.
Sure.
So, tell me about your original lupus story, your diagnosis story.
Okay, Mary, thank you for having me. My lupus story. I was officially diagnosed in 2011, and I say officially because years prior to that, I was diagnosed with things like bronchitis or respiratory infections, things of that nature, where I always ended up with a shortness of breath. And with those were periods of extreme fatigue, with migraines and sometimes rashes and other symptoms. But following a very tragic personal event in my life in 2011, I lost my spouse to a very tragic event. And within 6 months of that, I think my body, in just the stress of it, I just kind of went into a shutdown. And I was hospitalized with multiple symptoms, one being difficulty breathing. And when they did the workup, I had inflamed colon, inflamed lung, inflamed liver, inflamed everything, all major organs in my body. I was a complete shutdown. I was in isolation, required a PICC line, and they didn't know what was going on with me. They brought in a rheumatologist finally on probably the 11th day of my hospitalization. And the rheumatologist said, you know, we think something autoimmune is going on with you. We need to do a complete family history, and they, did further workup and came back with lupus as a diagnosis. And things started to make sense. And even as a nurse, that never crossed my mind.
Really?
Never.
So you were familiar with lupus as a nurse?
Vaguely. It was not my specialty. It was not my area. Inpatient surgical nurse, lupus was the furthest thing from my mind. And when my primary care PCP was telling me, oh, it's bronchitis, or oh, it's this, I was, get treated with steroids, antibiotics, feel better. Flare up again, exacerbate again, get better off the meds. I thought this was what it was.
Right.
So, yeah.
So it's interesting because healthcare professionals in medical school or in nursing school, there are so many diseases, they only spend a very short amount of time on lupus. So it's since there's no one test for it, it's really difficult to diagnose. And it sounds like it was difficult for you. It's not always difficult to diagnose, but oftentimes it is. It can take multiple doctors and multiple years.
And I think the trigger here was that stressful event. And I think the combination of that with the other symptoms, that was the defining factor for my diagnosis as well.
For sure. Stress is considered one of the triggers for acquiring lupus.
Exactly.
So that's a really powerful story. How did you learn how to live with it after you found out what you had? And you're probably a little relieved at first.
Well, I was relieved to know what it was, because once you know, then you know how to arm yourself. Like Dr. Jolly said, once you know what you're dealing with, you kind of know, okay, now I know how to fight.
Right.
And at that point, it's like, okay, now my kids have lost a parent. Now they have one left. So I know I have to fight. There is no other option for me. And that's the situation I was in.
And that's what you were in. So how did you, because you've managed your disease very well.
Well, I first had to educate myself.
Okay.
Because I'm a nurse, nurses do not all know about lupus, because we, like physicians, we typically specialize in some area. Okay, so that was not my area. So I had to start educating myself and learning about this. And that was my first line of defense, if you will.
Okay.
And then I had to start picking my team. My team would be, I knew I would stay with my primary care doctor. So from there I had to find a rheumatologist that I felt comfortable with. And then from there I had to develop a pulmonologist or someone that could take care of my lungs, because with my flare-ups or my exacerbations, I tend to have problems breathing. So my lungs generally take the hits with my flare-ups. Okay. So I had to develop my team and start doing my work of, okay, what medications, learn about this, learn what do I need to do to stay alive.
So you have a really strong medical support team.
I do.
And then do you have a family support team, a friend network?
I have, so my team starts with spiritual prayer. I don't push that on people. People have their own beliefs, but my spirituality and prayer starts. I pray every day that I'm able to get up out of that bed and move, because that's not a given with lupus.
Sure.
It can affect so many organs and systems in the body, and joints, and mobility is one of them. And then my family is amazing. My daughters are awesome, and I have to smile with them because I have one in particular who's learned those medications and how to make that cocktail, and by cocktail I mean the medications,
yes,
and how to drink. If I'm in a flare state, if I'm running fevers, you know what to do. She knows, she's on it. Now, at the moment, she's away at school. So I have another daughter who's home, but she's kind of learning how, and she's in pharmacy school. So she knows my doses and everything. So they're great. I have a great family support. I have a great co-worker support. I have great support at the support group that I started to help others, but it helps me as well. So all around, I'm well supported.
Well, let's talk a little bit about the support group
Sure.
while you're sitting here. And I know you started this with Dr. Jolly. We'll talk a little bit more about it. But why were you so interested in starting that?
So I got to a point where I felt like I needed just a little bit more for myself, and I looked in my area, which is Oak Park, and I said, great, there's a support group here. And so when I called the number, I found out that the group was defunct. Like it said it was meeting at the library, and I called, and, and then I emailed the lady, and then it just was non-existent.
Right.
So I was a little discouraged by that, and then I just kind of let it go. But then when I started at Rush, I says, wow, they have a lupus clinic here. Wow. I says, okay, this is probably the environment to, get a support group going, but not yet. I have to learn or, get myself settled and get established first. So I attended a event in October of 2017. It was a lupus education event. It was Dr. Sequeira did the morning session. Dr. Jolly did the afternoon session. I attended the morning session, and I registered with Paula Brown. And after the session, I emailed her and I said, I want to start a support group here at Rush. Who should I contact? She says, email Dr. Jolly.
All right, so with that, we're going to just take a quick pause, and I'm going to let everybody know about an educational event that we have coming up. Lupus Society of Illinois provides educational events at no cost to participants, and it's one of the many programs and services that we do. You can feel free to contact the Lupus Society of Illinois at www.lupusil.org, or go ahead and give us a call, 312-542-0002. So now we're back. I'm again Mary DeLear with the Lupus Society of Illinois. I'm here with LaShawn Gurula. Did I get it close?
Gurula.
I'm so sorry. And then Dr. Meenakshi Jolly. I'm with the Lupus Society of Illinois. Both of these ladies are with Rush. LaShawn is a nurse. Dr. Jolly is a rheumatologist who runs the lupus clinic. And we're talking about how they started their lupus support group, which has been incredibly successful in over a year, in just over a year.
Yes.
We are very thankful to LaShawn for spearheading that. I had been wanting to start a support group for ages, but I didn't have I couldn't just spread myself further thin into other areas. And when LaShawn reached out to me, and I said, listen, we really want to do this. We were just waiting for you.
Oh, great.
That's what she said, literally.
I'm not surprised.
She says, of course we would want one. I just don't have enough hours in the day.
So you guys got together. You decided that you were going to start a support group. And how did you decide on the format? Because yours has an actual speaker at every event.
So let me just a little bit. So the department I work in, social work and community health, and with that department, they have offerings through Rush Generations, and there are other support group offerings. So I kind of went there and then connected with you, and then connected with Dr. Jolly, and so there's a little work behind the scenes, but in formatting that educational piece of it, I worked with Dr. Jolly. I said, hey, let's try to do an educational piece, and she actually came up with the acronym. It's Learn at Rush, LEARN, Lupus Education Awareness Resource and Networks at Rush. That was Dr. Jolly's baby. With that name.
Smart lady. Yeah.
She's a smart lady.
I had the name sitting for years with me.
She came up with that, and then from there, I used the manual from LSI. There were some general topics. So for the first year, we used that to come up with topics, and then she helped me come up with the rheumatologist, and I work with the social workers in the Department of Social Work and Community Health to come up with speakers, and it's interdisciplinary. We have nutritionists, we have rheumatologists, we have therapists, we have pain clinic specialists, we have emotional wellness people. So it's all encompassing because lupus patients have complex and diverse issues going on. So.
Right.
Fortunately, we've had all our physicians that we've reached out to, physicians, healthcare staff, allied personnel, everyone willing to pitch in.
Yes.
This is all voluntary.
Yes.
So we've been very surprised and very, happy about it.
Yes.
So since it was such an important goal for you for so many years that you came up with an awesome acronym, how do you feel like that benefits the patients that we were talking about earlier who need a support system?
I think in many ways. Like I was telling you, patients are young and in so many diverse ways invested into their education. And, this is a time when you have friends, you date, taking care of people, vocation and everything. People frequently will lose friends when they develop lupus because they just can't show up for different things, or even for parenting, can't show for parent-teacher meetings. So they end up with a very shrunk support system. They are not old enough to have the kind of resources, whether financial, emotional resources, to deal with a chronic disease that takes so much of a toll. So we thought that with the support group, you would connect to other people with similar disease. You could get inspired that I'm not the only one that has this. Look, this one has worse than me and they're dealing with it. I can definitely do it. You can get to learn different ways how people are dealing with their issues and take some pieces from that. It is, supportive. It is a relaxed environment also. It's a sort of a network activity that is happening while you're learning in a very relaxed environment, and hopefully it would reduce some stress and anxiety.
Okay, great.
I think a unique way that we come about connecting potential support group participants is through different ways of referring, but definitely through a bridge connection at Rush, the doctors at Rush, social work, case management at Rush, because they get the opportunity to have bedside visibility with a bridge social worker or bridge nurse at bedside that can connect them to the support group by offering it, and then they get the pleasure of having me visit them at bedside.
Yeah.
And they love having someone connect with them at bedside that can share with them and identify with them on the level of, I live this life too.
I am certain that is a huge benefit to the people who come through there.
Yeah.
Yeah, because not everybody knows about lupus, and not only do you know about it, you live with it.
I live the life.
Yeah.
I live the life every day.
Yeah. So another question, what would you like people to know about lupus?
I would like people to know that I get told this, well, you don't look like you have lupus. Lupus doesn't really have a look. I mean, there are hallmark things like rash with lupus, but I look like this, but this could be a day that I'm not feeling so well. I would like people to know about lupus, that lupus is not an automatic life-death sentence, that you can live a life managed well if you build your team, follow your advice of your doctors, and be active and engaged in taking care of yourself and be proactive in that plan.
Yeah, my go-away points are pretty similar to that. Young people can have chronic diseases, and they may require attention. They may look fine from outside, but they may need medical care and they may not be feeling well. Be there to support them. At the same time, from a physician perspective, they may look fine outside, but do continue to see the physicians because we want to diagnose things early, catch them early, and intervene early to prevent any damage.
Right. And then another good question. What do you think the biggest misconceptions to lupus are?
I think one big misconception with lupus is that lupus is cancer. Oftentimes, some lupus patients may also use similar drugs that cancer patients use, and I think that's a misconception that they are one and the same.
Yes.
You know, another misconception in the medical world. See, cancer patients get chemotherapy medications, but they have access, and I'm happy for that, have access to a lot of support services and resources. For example, beauty or body image related wigs, makeup, support staff, emotional support, social work. Our lupus patients are also getting some medications that belong to the chemotherapy. Some of them are strong, some of them are not in the doses used for cancer. They do also undergo similar kind of issues, but our organizations haven't teamed up yet to be able to provide them with these resources. Like there is Look Good, Feel Better, and National Cosmetology Foundation works with the cancer organizations to provide free services and training to patients with cancer. You will see them at various cancer centers, self-management, meditational sort of resources. These kinds of things haven't figured out in our rheumatology world yet. Yes, they're not getting heavy-duty chemotherapy medications, but they do face similar issues and are on immunosuppressive medications, chronic disease, and I think we need to expand that too.
Expand the programs and services that are available to lupus patients for sure. Well, we did work with, like Cancer provides wigs for people who lose their hair and so they would take lupus patients on who are on different chemotherapies, and so we would partner where we could, but we could certainly probably partner more as a community, as the lupus community.
And sharing about these resources that are available with the physicians, because what good is the information if the physicians that are providing care are not aware of that? So include that in the education. Sensitize the doctors also towards patients' needs so that they can give them the information that these resources are available to you. Yeah.
You are taking a lead on that, Dr. John. But I want to say before we wrap it up, one big piece, if I may, and you hit on this maybe a month or so ago, with social determinants of health.
Yes.
And you're here with the medical management, but if we do not look here at things like psychosocial issues that a patient may face, if we are not correcting these, if you're prescribing and treating here, if we're not correcting here, transportation, financial resources, depression, medication affording things, if we don't fix this, whatever you're doing here is gonna fail.
Absolutely in sync with you. We may keep prescribing medications. As such, the disease is not curable. We do need to take attention to the patient and in their milieu, what they can afford, what they can do, what is doable within the resources, and what other resources that are feasible we can provide to the patient. We can keep writing prescriptions. It will not end up in anything. And we may label the patient as not being compliant with care, whereas it is other situations that may be leading in there.
Right. And that is something that the Lupus Society can help with. We do try and we have a modest financial assistance program that would help with pay for medications. Medications are incredibly expensive, so we are starting the advocacy group to deal with that, among many other issues that arise that are specific to lupus patients, but then also general enough for other autoimmune diseases, other diseases similar to lupus in scope and in size. But lupus, I think, is unique because it's so difficult to diagnose, and it is there's so few treatments available. So many people don't understand what it is, and I think that's because there's no one face of it. There are trends, but there certainly is not one face of it. There's no one story for lupus. It's just a very complicated disease.
And it's variable. I mean, I can work today, I can be disabled in 2 months from now, and I can go back to work, or I can be disabled for 3 months, and I can be back to work, or I can be totally disabled.
Or you could be in remission for 3 years,
exactly.
and then you have a flare. So it's really very.
So the financial picture changes back and forth.
Yes. It's very complicated.
I will say that
we do have to. I'm sorry. one last quick.
Yeah, I will say that the way to get forward is by working together.
Yes.
We work with LSI, with social
Yes.
work. We bring in the resources that we have and make them available to the patients.
Yes.
Interdisciplinary approach.
Patients are king, really, at the Lupus Society, and I'm certain at Rush. Thank you all so much for joining. Thanks to Dr. Jolly. Thanks to LaShawn for coming in.
You're welcome.
And we'll see you next time.